Dr. Rashmi Sharma. Today I'm going to tell you about a very distressed situation, which is early pregnancy bleeding. So recently you've got the good news that you're pregnant and then suddenly you start bleeding. It's a very panicky situation. But don't worry about it. It is very common to bleed in pregnancy. Almost 25% women will have bleeding in early pregnancy. That means in the first 12 weeks. But almost 50-60% of such women will continue to have normal deliveries and normal pregnancies. What could be the reasons for early pregnancy bleeding? So the reason may be that it is not bleeding from inside the uterus, but it is bleeding from the mouth of the uterus, which is cervix. Sometimes there are small lesions like cervical polyps and erosions which can bleed. And then sometimes it can be from inside the uterus, wherein there may be some subchorionic hematoma, that means there is bleeding behind the placenta. Sometimes when the placenta invades, it can bleed, which is called implantation bleeding. And then sometimes the pregnancy may not be normal, meaning the baby has already lost its heartbeat, which is called missed abortion, and now the body is trying to expel the fetus, and that's why you are bleeding, which is called missed abortion. And then sometimes the baby may not be there at all. You are pregnant, but the baby is not there. In place of baby, there may be a tumor, which is called molar pregnancy or trophoblastic disease. And sometimes it may happen that uterus doesn't have a pregnancy at all, but the pregnancy is somewhere else, that means in the tomb, which is ectopic pregnancy. Then also you can have bleeding. Okay, so these could be the reasons for bleeding. What you have to do if you have started bleeding, you are not supposed to sit at home. You are supposed to see your doctor. And what the doctors will do, first of all, they will take your history. They will try to judge, number one, how much pregnant you are, meaning how many weeks of pregnancy do you have, and then how much blood you have already lost. Is it too much? Because if it's too much blood, first of all, they would like to stabilize you. They would like to give you fluids, and first of all, they want to take care of your blood pressure. So they will check your pulse, they will check your BP, they will check your history, and then they will do upper speculum examination. That means they will see your cervix or the uterus mouth, whether there is any local cause for the bleeding. And then they will do your ultrasound, which is transvaginal ultrasound, which will tell us a lot about the health of the pregnancy. That will show us how much pregnant you are, whether the baby's heartbeat is okay or not, whether they can see any blood collection behind the placenta or not, and then how much open the mouth of the cervix is, whether you are just aborting or it is still there and you're still maintaining the pregnancy. And sometimes they're also able to see the ectopic pregnancy. That means they see that it's not there in the uterus, but it is there in the tube. And if it is a molar pregnancy, then also it is diagnosed by ultrasound. So ultrasound makes the cornerstone of any problem like that. Okay, sometimes they can order you a beta HCG blood test also. Okay, so they have done done all this test, and let's say your pregnancy is surviving well, then they will advise you bed rest. They will advise you not to travel. You are not supposed to have sex, and also they will prescribe you certain medications like progesterone to support the pregnancy. Sometimes they will give you some injections also to support the pregnancy. So you are supposed to follow the doctor's advice. In the end, I would say that early pregnancy bleeding is very common. It is around 25% patients who will have that. Do not panic, but do not sit also at home. You are supposed to see your doctor. Most of the time the pregnancy will continue well, okay, but you are supposed to follow the doctor's advice, right? You are supposed to take all those medications and injections which your doctor prescribes you. Thank you. If you have any more questions, you can write down in the comment section, and I would try to answer those questions through one of our live sessions. And if you wish to come to our center, we are based in Delhi. We have 3 centers across Delhi, and Economic Times has recognized our efforts, and they have awarded us as the best IVF center in North India consecutively in 2024, in 2025 also. You can see the number on the screen below. If you wish to come, you can take an appointment, or you can even take an online appointment. The link is there in the description box below. Thank you.